This is a short introduction to Penthrox. Penthrox, better known as methoxyflurane, is an analgesic for acute and minor traumas. It was chosen by me because when I dislocated my shoulder, I was in immense pain for 2 hours. But after 30 seconds of inhaling Penthrox, I felt immediate pain relief. This made me realise how far medicine has improved to allow pain relief during operations and procedures. This improves the sanctity of life by allowing more challenging and dangerous surgery to happen. Furthermore, it's a non-opioid alternative, which means people won't get addicted to this and abuse it. In addition, it is easier to administer because the patient can hold on to the inhaler, so no monitoring is required and the user can decide their own intensity of Penthrox by covering the dilute hole. Finally, Penthrox is better for storage compared to other analgesics such as nitrous oxide, because Penthrox is a liquid at room temperature and atmospheric pressure instead of gas, but it is very volatile, so it evaporates as the user breathes it in. There are common misconceptions between analgesics, anesthetics, and sedatives. Analgesics are a compound that provides pain relief without the total loss of consciousness, feeling, or movement. They also normally target a specific area. On the other hand, anesthetics are defined as a compound that provides a complete loss of physical sensations, so there is no feeling from the body with or without the loss of consciousness. They affect the whole body and may require a professional anesthesiologist to administer. Finally, sedatives will deprive the awareness, so the responses to external stimulus is limited, so it's not just pain, they are used to relax the patient. Penthrox is an analgesic. The structure of Penthrox is 2,2-dichloro, 1,1-difluoro, 1-methoxyethane, which is a halogenated ether. They contain ether groups and 4 halogenated groups. Halogenated alkenes are non-flammable, whilst alkanes are highly flammable. This is because tetrahalogenated alkanes have less CH bonds. Also, it has a staggered conformation because OMe group and the Cl group want to be as far of each other as possible, so their best position would be in an anti-periplanar position. This is to reduce steric hindrance so it's more stable. However, it's key to note that this isn't a staggered gouge conformation though, because it isn't the symmetrical shape, so it doesn't fit the ideal staggered gouge conformation curve. How is it synthesized? So, Penthrox, it's synthesized from 1,1-difluoro 2,2-trichloroethane, which undergoes dehydrochlorination by potassium hydroxide and gives 1,1-dichloro 2,2-difluoroethene, which, in the presence of methanol and potassium hydroxide, will become Penthrox. The history of Penthrox. Methoxyflurane was first synthesized in 1948 by William T. Miller and came into medical use in 1960s as a product known as Pentherane. It was used as a general anesthetic from the 1960s until the late 70s. Only in the last decade it was shown that Pentherane caused nephrotoxicity, which is the toxicity in the kidneys, which was found in 1966. The metabolized products were fluoride, dichloroacetate, and oxalic acid. Fluoride ions and possibly dichloroacetate acid was connected with nephrotoxicity, since O-demethylations, meaning the methyl group connected to the ether, was cleaved off, this bond over here. By 1970, 10 million patients have used Pentherane. In 1999, the manufacturers discontinued methoxyflurane in the United States, and in 2005, the Food and Drug Administration withdrew it from the market. However, in 2003, Penthrox was being developed at a lower dose and as an analgesic instead of an anesthetic by the Medical Developments International in Australia, and by 2015, it was patented with an activated carbon chamber. So as the user breathes back into the inhaler, any exhaled Penthrox will be absorbed by the activated carbon. There are 16 countries today, such as New Zealand, Australia, Ireland, and United Kingdom, that uses Penthrox as a pain relief. Penthrox impact on society. In the United Kingdom, the NHS pays exactly £17.93 per dose as of 2018, which is a relatively cheap analgesic compared to other products. Penthrox could be used to reduce the cost of analgesics by approximately £349 and 14p per patient. This is the average cost of analgesics for acute and minor traumas. This is because the average cost of analgesics for acute and minor traumas is £645 and 26p, whilst the average cost of Penthrox is £279.88 in 2019. The Medical Development International has earned just under $3 billion in sales per year. The pharmacokinetics of Penthrox. So, the Penthrox is first absorbed and it has water gas coefficients of 4.5, blood and gas coefficients of 13, and oil and gas coefficients of 825. The partition's coefficient is the ratio of concentrations of compounds in a mixture of two immiscible solvents at equilibrium. Hence, the partition coefficient is the measure of how hydrophobic or hydrophilic a chemical substance is. Methoxyfluorine enters the lungs in a form of vapor and is rapidly transported into the blood due to high blood gas coefficient. Therefore, there is a rapid onset of anesthetic actions. Distribution. Due to the high oil and gas coefficients of methoxyfluorine, it is a highly lipophilic substance. Therefore, it is more favoured to diffuse into fatty tissues so it can be collected in a reservoir and the pain should reduce. Biotransformation. Methoxyfluorine is metabolized by dechlorination and O-demethylation in the liver, mediated by cytochromose 450 enzymes, in particular the P450-2E1 and the P450-2A6. Methoxyfluorine will be metabolized into free ions and oxalic acid and dichloroacetic acid. Methoxyfluorine is more susceptible to metabolisms than other halogenated methyls, ethers, ethers. Elimination. Approximately 60% of methoxyfluorine uptake is excreted as urine as organic fluorine, fluoride, and oxalic acids. The remaining methoxyfluorine is exhaled as unaltered methoxyfluorine or as carbon dioxide. In conclusion, methoxyfluorine has a high lipid solubility, which gives it a low pharmacokinetics, which is the process where the drug is uptaken into the body, to the biotransformation they undergo, to the distribution of the drug and the metabolites in the tissue, and finally the elimination of the drug and the metabolites from the body over a period of time. A slow pharmacokinetics is better in medicine because the active substance in Penthrox will stay active for longer before the kidney converts it into inactive products. Pharmacodynamics is the way the body reacts to a drug. So in the case of methoxyfluorine, it changes the membrane fluidity and alters the activity of many ion channels and receptors required for cell-to-cell signaling across synaptic junctions. This means the body will respond by having the user experience less pain. In more detail, the methoxyfluorine induces a reduction in junctional conductance by reducing the gap junction channel opening time, increasing the gap junction channel closing time. Therefore, the drug induces muscle reluctance and insensitivity to pain. Methoxyfluorine also activates calcium-dependent ATPase in the sarcoplasmic reticulum in skeletal muscles by increasing the fluidity of the lipid membrane. Finally, methoxyfluorine also binds to GABA receptors, so calcium 2 plus activates potassium ion channels, glutamate receptors, and glycine receptors, leading to an overall reduction of activities in the neurons. The advantages of Penthrox. It is a relatively cheap analgesic since only 3 to 6 milliliters is required, but up to 15 milliliters can be administered per week. An anesthetist is not required. It is easy to store since it can be just stored in a locked cupboard. There is a rapid recovery rate since it only lasts between 25 to 30 minutes. There are also fewer potential adverse effects like addiction. There is a shorter delivery time so the procedures can happen quicker, which means a shorter time before discharging, allowing more patient beds. There are no drug-to-drug interactions. You can drive after 30 minutes. Children can also be administered with it, unlike morphine. There are no known resistance to Penthrox. However, through clinical trials, it is shown that continuous use will lead to renal failure before any known resistance. This is why long-term or high dosages of Penthrox is not advised. The disadvantage of Penthrox: it requires the patient to be conscious so they can operate the inhaler. Elderlies have to be conscious because this increases the risk of hypertension, which is low blood pressure, if they have repeated administrations for more than once every 3 months. Common side effects include anxiety, headache, sleepiness, coughs, and nausea. More serious side effects include kidney problems, liver problems, low blood pressure, and malignant hypothermia, which is the fast rise in temperature due to muscle contractions. It is only recommended to those who have normal levels of consciousness, stable blood pressure, and heart rate.